Hi, I'm Shona. My name is Shona Griffith. I am from Guyana, which is in South America, and right now I live in Belize. I live and work in Belize as a judge in the Supreme Court. In April of 2012, my medical issue was that in retrospect, I suffered from a ruptured appendix, which required an emergency open abdominal surgery. And what was discovered was that my appendix had ruptured, dislodged, and found itself behind my bladder. And from that, I had a massive infection in my entire abdomen. As part of the surgery, all of the infection, as far as I was told, they had to take my intestines out of the abdominal cavity and basically clean out the infection and clean out around the organs. And even my gallbladder was too much in an infected area. They had to remove that surgically and then put my intestines back in. When I was discharged from that surgery, I was told by the doctors that I would be at risk for complications arising from abdominal adhesions, and that was it. At no point in time did I even know what adhesions were and what the complications could possibly be. But along I went in recovery and gradually worked my way back up to the level of fitness. I was pretty active before and more or less healthy and safe. So in July of 2015, I underwent a voluntary hysterectomy, unrelated to anything to do with the prior surgery. But 2 days after that, I had to be readmitted to the hospital with what turned out to be the first of my surgical interventions on an emergency basis for complete bowel obstruction. My entire intestines were stuck together like a ball. The surgeons were amazed, and they all had to be unstuck and removed and cut away all of the adhesions. But again, in April of 2016, the very next year, I was admitted and had emergency surgery again. And this time, the adhesions, it went as far, what I was told is that there was an intersusception of the bowel, meaning that one part of the bowel had collapsed into the other. And that had to be surgically repaired. That was another emergency surgery. So the midline incision that I had from the very first surgery ended up being cut into 3 times. And after that 2016 surgery, up to that point, no one told me about what to eat. But essentially, I started to wonder and to question, because if that was going to be what I had to contend with, it was very, very scary and very traumatic to think that every couple of months or every couple of years that I would have to go back into surgery. And the surgeries are critical. They're major surgeries and require a major period of recovery. The response was, there's nothing really you can do to prevent adhesions from forming. As a matter of fact, from the time you go into surgery, within half an hour of surgery, the adhesions start to form again, and it's just the body's natural healing process. So if it happens again, you'll just have to have surgery. And that was basically the response that I had to contend with. So I started to read, and I was also doing physiotherapy. And I did research, and I came across this place called Clear Passage. And on the website with Clear Passage, there was bowel obstructions, mention of adhesions, and I said, aha. So I started to research and read about adhesions, and by that time, because of the trauma that I'd been through, and because of the very last experience with surgery, which was that it was just deja vu, the same thing over again, I came to the conclusion that there was really nothing more that medicine could offer me, because in trying to get from the doctors, well, what could I do so that I don't have to go through this again? First of all, I was impressed by the fact that they had so many locations, not just in the US, but in England and in, I think it's Europe. And that gave one level of legitimacy to it that I was comfortable with. And then I even, I Googled Larry and I Googled the work. I Googled some of the studies that they were doing, and I could see from the responses, the links that I got, that these were legitimate and very, very well researched work that he was doing. So I said, at that point, I had nothing really to lose. And as I said, medicine had nothing to offer. It was just, let me try and see what this would do. So I made contact with the website and via the contact on the website, and I did that. I didn't really have any expectations, but from that first initial contact, it was a full half an hour with me telling her my history and my story, and I was really in a place that was so comfortable that this was a product, A, that was legitimate, and it was worth giving a try. So I can move now to making all of the arrangements and that process. It's what I would call very meticulous. And that was yet again an additional layer of legitimacy for me. I really had to submit all of my medical history, and there's one thing that resonates with me. They say, even if you don't think it's relevant, tell us. We want to know everything. So it's so thorough, it's so meticulous, and I like the fact that they said, we don't guarantee that we'll accept you as a patient. We just have to be sure so that we can ensure that we give you the best care and that we can in fact truly help you. That was fantastic for me in getting here. So that being said, that being done, the arrangements were made so that when I actually got here, there was nothing else in terms of any arrangements that had to be done. It was more or less very seamless. So when I got here, I would say I tend to be direct like this. I'm not American, and I'm a person of color. So I didn't quite know what to expect until that point. What I met was simply being treated as a person. The fact that I was coming from somewhere else, the fact that I'm a person of color, it had absolutely no relevance. I was immediately very comfortable. I was immediately very welcomed, and then the treatment started. I would like to say that when you actually get to the place of clear passage, that's when you get inside, it's more like a home. It's warm, it's welcoming, it's comfortable, and that also says something about the organization that is run, and it says that something about the organization coming from the top. That would be Mr. Larry and Belinda. Right. So then we went into the treatment, and that was in January of 2017. I had two therapists who worked on me in addition to Larry, I think just one time. But it's different in that I didn't quite know what to expect with the hands-on treatments, but the explanations I got of what adhesions were, how they worked, how they would affect the way that I feel, the way that I eat, the way that my body can move, that was all given to me very seamlessly by the therapist as they worked. Now, the work is not, I don't think, for me, for the faint of heart. But by the time you've had several surgeries and you're there with the trauma of having another one just hovering over your head, the work that's actually done pales in comparison to that kind of trauma. So if you wish to balance, then there's no real comparison. But it's not ordinary physiotherapy. It's very, very deep, hands-on manipulation with a very scientific basis attached to it of what adhesions are, understanding how they form, understanding how they inhibit your tissues and your muscles, and an overall understanding of the body mechanics and so on. it really was phenomenal. So in terms of that physical aspect of it, from the very first day, it was already worth it. I felt better. I stood better. I remember walking as I was required to do after the first session and just having the feeling of standing up straighter and striding. It was phenomenal. So the actual treatment for me, it works. It's very much worth it. And more than the physical treatment, the therapists themselves, very warm, very approachable. The key, compassion and genuine caring. And that's what I got. My very first experience, I remember, and it actually did say so on they give you a handout that says what to expect. It says you can expect some emotional release. I went, bah, this is physical. Because I'd never really dealt with the trauma of the surgeries that I had, it still was very much pent up. It was a hard place to return to, and actually having someone lay hands on that surgical area, which had been through so much, was very, very traumatic for me. And I remember the particular therapist that I worked with, whereby I was able to tell her, while she worked, she's still paying attention to me, of what I experienced, and she basically talked me through it, and I had that release. And I was not able to do that before, but she was in a place where she was with me, and she could, because she knew what was going on inside, she was able to get me to speak about something that was very hard without just an air that says, I'm listening because this is what I'm supposed to do. It was more, I'm here for you. And that was also very, very phenomenal. So if you're in a place where you have all that pain, you have absolutely no idea what medicine can do for you, or even before you get to that stage, I can honestly say persons will make up their own minds, but I can truly sit here and say that the service and the value that I have gotten from Clear Passage can't really put into money terms. So for Larry and Belinda and the entire staff, the therapists, the support staff, I want to say thank you, and Clear Passage, they would be here for you.